That's what I love about OSS is that you try to do things before going to like surgery. You always try the other options where some of the other doctors that I've seen in the past, their first solution to treat something is go straight to surgery.
I think the first thing is to make a good diagnosis and not just really treat the symptoms. And I like to just give you options, and you tell me how aggressive we need to be based on the severity of your symptoms and how it's impacting you. Fortunately, a lot of things can be healed and improved, and you have functional gains without the need of surgery.
I don't know if you recall, a few years ago, I went to do something on a Sunday and my back just did this horrible spasm, and I was having trouble getting out of the chair, going to conference rooms for meetings. The pain was going down my leg, and I called your office and was like, I really need to get in, like, this is horrible. And you made time during the lunch hour to get me in so we could determine what was needed in order to make the pain go away.
Yes, and I think whenever something is out of the ordinary, something's not making sense, we always want to make time to get you in and assess what's going on.
With the hip and the different procedure, there was that 2 weeks with the walker. And I remember sitting in the office and you telling me that, and everything's going through my head of how am I going to get through 2 weeks of non-weight bearing? Just you putting me at ease, we'll make sure you're not in pain. How about I give you something to relax before? And that 2 weeks, I would say the first couple days of trying to figure out the walker was a little challenging, but now that I'm a couple months post-procedure for that, the difference in how I'm feeling and, you know, being able to lay on that side again and be able to walk up and down the stairs and not have the pain, you know, getting up out of a chair and walking, it was definitely, you know, worth that 2 weeks of a walker for, you know, the relief that I got.
Yes, there's a little bit of downtime after the procedure, but time flies quickly and then you're back to doing all your activities. So this is great to hear that you've had such a great outcome.